Wanted to go over the terms that we use in pharmacology when we're talking about medications or drugs, and we prefer to use the term medication because drug has a bit of a negative connotation. So we try to say medications, but really we use them pretty interchangeably. The first one is indication, and the indication is the reason why you would give a medication. So this could be something like oral glucose. An indication for oral glucose would be that the patient is hypoglycemic or their blood sugar is low. For aspirin, indication would be chest pain. So if a patient was having chest pain, you would give aspirin. Now, a contraindication is a reason not to give a medication. And the first one, and one you should ask before giving any medication, is allergies. You want to ask if they're allergic to anything, and then ask specifically if they're allergic to that medication. So if I was going to give aspirin to someone that was having chest pain, I would ask them, are you allergic to anything? And then I would ask them, are you allergic to aspirin? Now, for aspirin, there would be other contraindications, such as if they've ever had a bad reaction to it with asthma or breathing problems, or if they have active GI bleeding, we wouldn't want to give it then. Each medication has its own list of contraindications. The next term is dose, and dose is just how much you're going to give. So for like oral glucose, the dose would be 15 grams. For nitroglycerin, it would be 0.4 milligrams. So every medication has a specific dose. You want to make sure you get the dose right so you give the right amount for the adult, for the patient. Sorry for switching minds there, because also along with adult dosages, which is what we typically memorize, there are pediatric dosages. Now, most medications that we give at the EMT level, either we're not going to give to pediatric patients or there's not a lot of difference between the doses. So like oxygen, the doses are the same for child and adult. Aspirin we don't give to children. Nitroglycerin would be kind of a weird one to give to a kid. Oral glucose, that might change a little bit between the adult and the child. We want to give the appropriate dose. And most of the time, pediatric doses, child doses, are based on weight. So you have to know how much the child weighs. And we have to ask the parents, or you can make a guess. They make what they call length-based resuscitation tapes, or wheels or some other devices to kind of get an estimation of how much a child weighs, and that might help you figure out how much of a medication to give. Administration. Now, administration is just how are you going to give it. So like oxygen, we're going to give through a nasal cannula or a non-rebreather or CPAP or a bag valve mask. Something like aspirin, we're going to give orally, where they chew it up and swallow it. Oral glucose, we're going to give buccally, between the cheek and gum, and let it get absorbed that way and let them swallow some. Nitroglycerin, we give sublingually underneath the tongue. So administration is just how are you going to give it. Actions. Action is what we expect to have happen in the body. So things like oral glucose, we expect to raise blood sugars. Nitroglycerin, the action is actually to become nitrous oxide, and it can then dilates blood vessels. So we expect the blood vessels to dilate, which then would reduce the preload and reduce the stress on the heart, and then the heart won't work as hard, so hopefully the chest pain will be reduced. And it might also dilate some of the coronary arteries and increase blood flow and oxygenation to the myocardium. So that's the action or mechanism of action. Side effect. This would be something that may happen. Not all patients experience side effects, but they might. And it's not really what we want to have happen, it's just something that happens by taking the medication. So going with the nitroglycerin, it dilates blood vessels, including the ones in the brain, which then causes a headache. So a lot of patients that take nitroglycerin have a very severe headache. A side effect or a common side effect that you may use is a side effect of Benadryl or diphenhydramine is it makes you sleepy. So a lot of people will take that as a sleep aid. In fact, medications like Tylenol PM or ibuprofen PM or ZQuil are all basically just the medication like Tylenol with diphenhydramine or Benadryl. So they combine the two medications. Tylenol really doesn't do a whole lot for you, but the Benadryl makes you sleepy. And then you hopefully will sleep better. That's the side effect of it. It's not the desired effect of taking Benadryl. Take Benadryl for allergies. It just makes you sleepy. So I hope that helps with some of the medical terminology that we use in the pharmacology chapter. There's a whole lot more that we could use, but those are the primary terms which you need to know when you're looking at the medications.